I think we're moving towards the direction of, from a regulatory perspective and in general best practice, I think a lot of people would say that you should obtain some form of consent in the use of AI for your patients right now. I think that's probably the right call. I think that makes sense, again, because I think of it as a new and emerging technology. And I think as you start to use something new, you should at least be providing your patient with information around what it is, what kind of tools you are using, whether it's like full informed consent and you're asking for or for consent in those situations. I don't know if we're necessarily there. There's a question of whether or not patients can or should be able to opt out of AI being used in their healthcare is really interesting, right? I think right now in the current state, AI right now is not the standard of care, right? Like we sit here and I don't think that anybody would say it is the current standard of care to use AI for any particular thing. Will that change over time? I think probably, right? Like I definitely think there is a future state, whether that's in 1 year, 5 years, 10 years, where artificial intelligence, whether through basic workflows or through for clinical decision support, is a part of standard practice and considered standard of care. Yeah, I think we're going to get there. At that time, are you ultimately able to opt out of that? I think that's where it's going to be really fascinating to know, are we able to even do that? I think about one of the things I'm most fascinated about is right now we can pretty easily carve out what is AI and what is not in your kind of digital workflow as you're taking care of a patient. So as you're taking care of a patient, you have a pretty good idea. And as an EHR vendor, we have to make it readily known to you if and when you are using AI in your day-to-day care, so you know what those pieces are. I do think that we're going to get to a point where AI is so embedded in the EHR and so embedded in the workflow, it's really going to be impossible from a digital perspective to carve it out, right? Like I can't just turn off AI for this feature and go back to the old school one and turn it on for this and turn it off for this. And are we going to have two different versions of an EMR, one that has AI and one that doesn't? And I have to work through that. That doesn't feel like it's going to happen. I don't know. I'm going to be very curious to see the patient's perspective on artificial intelligence. My current hypothesis is that patients are going to be pretty ready to have this used in their routine care, but I'd be fascinated to know like what other doctors are seeing or experiencing as they talk to patients about that. I know as we roll out these ambient tools, a lot of our practices are doing consent. I'd be very curious how often they're not consenting to those things and what the rationale is for that. I think that people can, especially this day and age, are very skeptical of all things healthcare delivery. So I wouldn't be surprised if you have a subset of people that are skeptical about AI and don't want that used. But is it exponentially going to grow or is it going to shrink? I think that's what's going to be really interesting. But I do think there will be a pit, like if and when we have a harm event that occurs because of an AI tool, and that news story that breaks of this patient was harmed because of this specific AI tool, I think that is where I'm going to be really fascinated to see where the perception goes. And do we totally migrate away from, I don't want AI in my care, we better not be using AI? I could unfortunately see that happening. And so it's like, how do we avoid that?